According to recent statistics, about 75 million U.S. residents endure chronic or recurrent pain. Migraines plague 25 million Americans, while 1 in 6 suffers with arthritis. The first line of treatment for these types of pain is often medication, which may not be the best course of action.
For a large number of patients, they have risk factors that may cause this course of action with narcotics to be a problem for them. They may have genetic predisposition to addiction, and so those things need to be taken into account. In the last couple of years, hyperalgesia has become a significant problem in treating chronic pain. We have many patients that have been on narcotics for quite a while, and these patients are developing tolerance to medications, and it's actually altering the chemicals in their brain so that narcotics no longer work. These patients may be switched from one narcotic to another narcotic, and the dose is increased and increased, yet they continue to not get pain relief. In fact, their pain gets more severe. This requires a special type of doctor that's trained to treat this condition. They must be weaned off all narcotics, and other modalities of treatment are necessary. These are a few of the reasons why we feel that it's necessary to treat chronic pain with a multidisciplinary team.
There has been a sharp increase in the use of narcotics in America. The Centers for Disease Control has labeled prescription drug abuse as a national epidemic, claiming thousands of lives across America each year. Doctors have to be able to safely guide their patients with addiction issues, but still treat their pain effectively.
When you're looking for a physician to help treat your chronic pain, you really want one that is both board certified in pain medicine and addiction. That gives you more trust that this doctor is able to know the fine line between, are we giving narcotics and crossing that threshold into addiction, or are we still treating true pain with medications or interventional pain procedures?
The good news is that over the past decade, we've seen a growing number of medical advances in the field of interventional pain treatment. Across its multiple locations throughout Georgia, Spine Care and Pain Management uses interventional pain methods combined with the skills of physicians board certified in both pain and addiction medicine. Their primary objective is to facilitate your recovery by providing nationally recognized quality of care. Its staff of caring professionals are focused on meeting your chronic and acute pain needs and exceeding your expectations.
I got into pain management because I wanted to help people. I wanted to change their lives and make them comfortable so that their quality of life improved and they could raise their families and hold down jobs. And we started to train in addiction medicine so that we could figure out which one of our patients were addicted, which one of them truly needed this medicine, and which of them could be controlled with other modalities. Through doing this, we have come to realize that it's the whole community that we have to train and we have to teach. We have to talk to doctors about responsible drug prescribing, and we have to talk to parents about their children. We have to talk to pharmacists about recognizing bad patterns. This is the only way that we can help solve this epidemic and treat the patients that truly need our help. A lot of these patients can be treated with non-narcotic modalities, with therapy, with psychological counseling, with injections, with surgical devices that control their pain instead of drugs. A lot of patients, when they're giving drugs, very bad things happen to them through no fault of their own. This is our practice dream, to not only be compassionate and provide goal-based directed care, but also to change the environment of today's pain clinic and pain treatment.
With the wide range of procedures available today, more and more patients are discovering how many types of chronic and acute pain can be significantly improved and narcotic painkillers reduced or eliminated entirely.
I came to Spine Care and Pain Management about 4 years ago. I guess lifting all the years, heavy stuff, furniture, children, whatever it might be. I put a whooping on my back. And I was on a lot of pain medication, didn't feel like myself, and I just wanted some different kind of relief.
The main thing I feel that makes our practice different than other pain practices out there is we pre-screen our patients. We do extensive testing to make sure our patients don't have risk factors, either genetic or psychological comorbidities that may make treatment with narcotics very, very dangerous for them.
I do feel a lot better now. I have good days, I have bad days, more better definitely than bad. I'm just down to one pain medication. I can take it and work and feel fine, and I do my massage therapy, and I just feel a lot better.
We treat mind, body, and soul. We use psychological techniques, we use interventional procedures, we use pharmacological agents to help the patient, both non-narcotic or narcotic usage. But really, you need someone that can toggle between all those worlds and help you in an efficient fashion.
We are now doing genetic testing on our patients to determine which medications are beneficial for them and which could harm each patient. We are also developing our wellness program for the long-term care of our patients. They can participate in nutritional counseling or continue to consult with their therapist, psychological or physical, and other modalities.
I'm able to see the true circle, the patient that comes in who is absolutely, their lives are ravaged by addiction, and helping them to get insight, treatment, and then placement into the proper setting so they can live a fulfilling life.
Prescription drug abuse can happen to anyone, at any socioeconomic level, and at any age. If you are one of the 75 million Americans who suffer from chronic pain and are frustrated with treatments that don't provide lasting relief, make your appointment to visit Spine Care and Pain Management today and get back to your active life. For more information, go to tameyourpain.com or call 855-549-8114.